Hello, my name is Malcolm. I'm the CEO of Generation Care, and I'm a psychologist. Generation Care is running a number of seminars on topics that are relevant to the type of work that we conduct, namely working with older Australians, that is people over the age of 65, or in the case of Aboriginal people, people over the age of 55. We'll be running a number of seminars. This one is entitled Working with Older People from a Mental Health Perspective. In it, we'll be touching on issues such as the importance of mental health in aged care, and the signs that can identify mental health issues. So in this seminar, I will be presenting some information about the need to look at both physical health and mental health issues. I'll also be talking about the importance of mental health in the elderly as a topic. I'll be discussing some common mental health issues in the elderly, the causes of mental health issues in the elderly, some signs to look for, and then finally what it is that we can do to help older people with mental health and associated issues. The first point that I'd like to make is that we are one in the sense that we have a physical health side of ourselves, and there's also a mental health side of ourselves. Indeed, there's probably other sides, including a spiritual side to ourselves. Whilst this webinar will be looking at, or primarily will be looking at mental health, it can't be seen in isolation. We need to look at people holistically. We need to look at the whole being, their physical health as well as their mental health and other aspects of their being. One of the themes that I hope will emerge from this webinar is that there is an interconnection between physical health and mental health. We'll see this playing out, as it were, especially amongst older people. But there is a relationship between our physical side and our mental side. There is very, very much an interconnection. And so in approaching care and the health of elderly people, there is a necessity to look at the whole person, to take a holistic approach. Indeed, when I was preparing this webinar, I initially put the word advantage. I thought at first that I should be saying that there was an advantage to applying an holistic approach to healthcare. But on reflection, I thought, actually, no, it's not necessarily an advantage. It is, in fact, more of a necessity than anything else. So why this topic of mental health for the elderly? Why is this such an important topic? Well, partly because of the numbers of people involved. At the moment, it's estimated that 15% of our population is aged 65 years and older, and that proportion is set to rise with the aging of the population. With time, and actually not in a lot of time, the proportion of older people in the population will increase. There are various estimates. I suppose it just depends on who you ask, but approximately 200,000 older people live in some type of residential care in Australia. I have seen figures lower than 200,000. I've seen figures of about 150,000 people. I've actually seen some figures higher than 200,000. On any view of it, though, there's a lot of people, a lot of older people in residential care. And surveys that they've done have indicated that a substantial proportion of older people, whether they're living in residential care or whether they're living in the community, a substantial proportion of older people have mental health issues. So in the general community, for instance, amongst adult people up to the age of 65, at any one time, there's about 20% of people who've had some experiences of mental health problems. But amongst older people in the community, that figure is higher. It's, according to at least one study that's been commissioned, it's at about 30% of people, and that was of older people, and that was older people with significant symptoms of anxiety or depression. And then if we look at older people in aged care facilities, the proportion of older people in those facilities with mental health issues is even higher. So quite consistently, they find that about half of people, or over half of people in some studies, in residential care facilities have been diagnosed with dementia. Estimates of older people with other sorts of mental health issues vary, but there is at least one study in 2012, which was the largest study done in this area, that indicates that another 50% of people in aged care facilities had significant symptoms of depression or anxiety. So you'd expect that with these high rates of mental health issues amongst the elderly, you would expect that there should be high rates of treatment and support for elderly and their mental health issues. Unfortunately, though, that's not the case. In one survey, it was found that less than 1% of aged care residents were receiving any type of psychosocial treatment. Anecdotally, it would seem also that there is a lack of mental health care and support in residential care facilities and also in the community. It also seems that of all the available treatments for mental health issues, medication is the treatment of choice. Now, of course, medication does have its place. Medication does work for people with severe and persistent and significant mental health issues, but there are other mental health treatments, including, of course, psychotherapy. And it seems that those types of alternative, but nonetheless evidence-based mental health treatments are not being provided to older people. And I've come across one survey of 290 aged care residents, of whom 49 met the criteria for a major depressive disorder. But of those 49 residents, only one was receiving psychological treatment in the form of therapy. 89 residents within the nursing home were prescribed antidepressants. Now, perhaps that could have been because they were prescribed antidepressants as a type of prophylactic treatment. But clearly, just from that survey, it would indicate that there was a significant under-treatment of mental health issues applying CBT and other psychotherapy treatments. So there are a variety of mental health issues that can appear amongst older people. There are, you might say, like the usual, the expected mental health issues. They include anxiety and depression, substance abuse, bipolar disorder, and other mental illnesses, the types of issues that one would find in the general community. In addition to that, there are some other conditions that are more specific to older people. For example, older people also experience mental health issues as a consequence of cognitive decline. Of course, there's also the issue of dementia. That's not, of course, restricted to older people, but dementia is a condition that predominantly affects older people more than other people in the community. And also, as I've indicated before, there is a connection between physical health and mental health, and there are some physical health issues that correlate with mental health problems. So, for example, heart disease, cardiovascular problems can also bring about associated mental health issues, chronic pain, diabetes, other types of health conditions have correlated mental health problems. So there's a whole range of mental health issues that can affect older people. And similarly, there's a number of likely causes of those problems. A significant cause that can affect older people is the experience of loss. And loss can come in a number of different forms. So for an older person, loss can be experienced through the loss of a loved one, a life partner, a spouse, a partner, who may pass away, or who may experience cognitive or physical decline, and the partnership with that loved one therefore changes. So they can experience a loss in that respect. Also, individuals, older people, can experience loss in other ways. It's the experience of physical decline, the knowledge that those things they were once able to do, they're no longer able to do. The loss of agility. It could be something as simple as the loss of a driver's license. As people age, so it becomes more and more likely that they become unable to drive a motor vehicle. And with that loss comes a realization that life for them is changing. There is a loss of independence for some older people, which can then cause associated mental health issues. So loss can come in a variety of forms. There can also be change. Now, the change could be in terms of employment status, going from an employed person to being a retiree for the first time. Other change might, and a significant change, in fact, is change of residence, which of course can also be associated with loss. So that's a change that can happen when someone, an older person, is required to move from their home into a residential care facility. Maybe it's a home that they've lived in for a substantial part of their life, and having to undergo that change and living in different circumstances in a more communal environment can bring about issues to do with adaptation. As I've also briefly mentioned, ill health can be, of itself, can be a cause of mental health problems. So can cognitive decline, and so is isolation and loneliness. And of course, we're experiencing that at the moment with COVID-19 and social isolation. But of course, for older people, isolation and loneliness occurred for them well before COVID-19. That isolation and loneliness can come in a number of different forms. It can be generated because of distance from family members, physical distance. It can also come in another form to do with hearing impairment, that type of impairment or disability that inflicts a social isolation on someone, they're unable to engage in conversations in the same way that they were once able to. And that can cause a sense of loneliness and social distance. For some older people, they have a predisposition to mental health issues. For some older people, they've been living with a mental health issue for most of their life. For others yet, it may be that they had an underlying condition which did not become evident, and it only became evident as they aged. Of course, older people are subject to falls, and there is evidence that having a fall itself can bring on symptoms of mental ill health, particularly depression, although interestingly not so much anxiety. And then another possible cause is just the stress associated with financial concerns as someone ages. There are other causes, of course, but these are the main ones. Delving a little bit more deeply into isolation and loneliness, that is a major issue for older people. Social isolation can be categorized as social disconnectedness, a disconnection from others. One can have a social network available and yet not be entirely connected with that network. Loneliness is more of a perception and a feeling. We often hear of older people who may be literally surrounded by others. They may be surrounded by people, for instance, at a residential care facility. They may even be surrounded by family members, and yet there is an enduring and, for some people, almost overwhelming sense of being alone and lonely. Partly that might be because of impairments such as hearing impairment. But it can also just be generated by other issues. This sense of loneliness can be generated by feelings of anxiety and depression. And similarly, so can feelings of anxiety and depression generate feelings of loneliness. It can be a vicious cycle. That sense of isolation and loneliness can also itself generate physical health issues. People can take longer to recover from physical ailments because of the sense of isolation and loneliness that they experience, which then in itself can create further isolation and engender further feelings of loneliness. Again, an example of a vicious cycle that can be created for elderly people. So when we're working with older people, and when we're with older people on a social basis, what are the things that we could be looking for to identify whether or not they may be experiencing some type of mental health issue? When there is a loss of any type of nature, but particularly a loss of a family member or loss of a loved one, then when that occurs, then it's more likely that some mental health issues will arise. Similarly, when there is a change, and in particular when there is a change of home environment, when they move from their residence to a residential care facility or some other type of facility. So that can be a time where we need to be more vigilant and look out for older people and ensure that they're mentally okay. If they're showing behavioural signs of anxiety or depression, that can come in many forms. It can come in the way that they look, whether they appear downcast, sad. lack of eye contact, which is one of those that I've itemized there on that list. The way that they talk, the way they speak, the way they hold themselves. Quite often we can pick up these signs of anxiety and depression in others, and we can do the same with older people. If there's any avoidance, if they're particularly avoidance of certain situations, activities that they would usually be interested in, or the avoidance of certain situations, especially situations that involve socializing. Sometimes they may exhibit an urge to perform certain types of rituals or checking behaviors, other, you might say, compulsive type of behaviors, which they can apply as a way of relieving anxiety for them. If they're having difficulty making decisions, now this may of course be attributable to the very difficulty of the decision itself, because some older people need to make very difficult decisions from time to time. It may also be just due to a cognitive decline, but sometimes it can also be due to an underlying mental health issue. Other things to look for include being startled, people being restless, a lack of self-care. They're not looking after themselves in the same way that they used to be. They're not looking after their home in the same way that they used to. Lack of motivation. They just seem to do things that are a bit out of character, that are different. Whatever it might be, I think if we have that concern, then we are under an obligation to ask, to inquire, to find out if everything is okay or not. One point that we do need to make here, of course, is that not every older person will experience a mental health issue. They may sometimes exhibit some of these things that I've listed here, but that does not necessarily mean that they do have anxiety or depression or one of the other mental health problems. We've also got to keep in mind that older people can be incredibly resilient. They have a lot of strengths, and we shouldn't be making too many assumptions. We certainly should not be jumping to conclusions. Nonetheless, if we do see these signs, we ought to do something. And what is it that we can do? Well, the first thing is to ask, to find out how that older person may be traveling, how they might be going. But in doing that, don't always expect to be told straight away that there is not an issue, because it may take some time for the older person to reveal that there is an issue. As I said before, we should be alert at a time of change, or when something concerning may have happened in that person's life, when they've experienced loss or some other type of situation. Of course, we should be spending as much time as you possibly can with the older person, so that we do become aware of any issues that they may be experiencing. Above all, we need to talk with them, and above all else, we need to listen. We need to observe. We need to notice. We need to listen to them. We need to be with them, and be in a position where we can identify if there are any issues. Of course, the old adage is that prevention is better than cure. And that's certainly the case with older people. We should remain connected with the elderly. Right now, that is problematic. because of the social distancing requirements with COVID-19. Remaining connected with elderly people can be challenging at the moment. It can also be challenging at other times. But if you think about it, it really doesn't take a lot. It can be as simple as a phone call. We should not assume that elderly people cannot use technology, and so there's some technological ways in which we can remain connected with elderly people via the internet. We should use those as often as we can. But also visiting, writing letters in the more sort of traditional sense. But in all sorts of ways, we should remain connected with the elderly. As I said, it doesn't really take a lot of effort, but it's an effort that's well worth it. As much as possible, we should enable the elderly to be connected with each other. One of the practical issues that often confront older people is lack of transport and their capacity, their ability to be able to move and to remain connected via usual social activities. If we can find a way, and there are plenty of community agencies and services available, but if we can utilise those services to enable the elderly people to remain connected, so much the better. As much as possible, we ought to provide autonomy for the elderly and provide choice. So it's about empowering them, reminding them that they do have a sense of choice over their decisions. Sometimes people don't have that feeling. They feel that as they get older, as their physical health declines, as their ability to do things declines, so choices are being taken away from them. The reality is that sometimes that's true. The reality is that fewer choices do become available for people. But as much as possible, it's very helpful to nonetheless provide choice to the elderly and provide them with a sense of autonomy, even in simple things. And also suggesting activity. Again, this is the point that I made at the beginning, that there is a connection between physical health and mental health. The more active a person is, the better the health outcomes for that person are. Any type of activity at all will help. It does not have to be strenuous. Anything that engages the person in some type of movement will help, and in something that engages their mind as well as their body will help. Those activities would include a hobby that perhaps the older person has previously conducted or would like to pick up again. Activities for older people would also include any type of social connection in any manner, whether it's with friends, former friends, family members, other elderly people in their community. Exercise, gentle exercise can be of assistance, can be of use. And this will be the subject of some other seminars that we're presenting. Some other types of activities for older people include the ability to reminisce, just the opportunities to tell stories of the past, to remind themselves and to remind others of events from the past. That can help. Reminiscence therapy, which is a type of therapy that utilizes reminiscence as a therapeutic tool, has some evidence base behind it and can be useful for elderly people. A common issue for older people is sleep disruption, and any type of intervention that can be applied to alleviate sleep disturbance will help. what we would call sleep hygiene, a series of preventative or assistive processes that an older person can put into effect to help them maintain as good a sleep as possible. Some studies have indicated that psychoeducation for elderly people who are well will assist them to remain well. So the psychoeducation would be in the form of usually group activity, and it would be something as simple as informing them, educating them about mental health issues and the types of things they could be doing for themselves and for each other to help them with those mental health issues. Something similar to what it is that I've been discussing in this webinar. Studies have indicated that that type of information sharing for elderly people will help them and will help achieve better outcomes. Mental health first aid is one of those psychoeducative programs that will help not only the carers of older people, but may also help elderly people themselves. And finally, normalise the situation for older people. Let them know that what they're going through, whatever that might be, is to be expected in the circumstances. It is not entirely unusual, that they're not alone, and also that there are therapies and supports available to them to help them. That sense of normalization will help anyone, but especially someone who's older. So that is the webinar for today. Thank you very, very much for your time. This is one of a series of webinars, as I've indicated, and in other topics, we will be looking more closely at physical health issues, and also doing a dive into particular mental health and associated issues that confront the elderly. I look forward very much to meeting with you again at the next seminar. Thank you.